Rishi Ratan, he's a trauma surgeon. He works to save the lives of COVID-19 patients now in South Florida.
One of the things that keeps coming up is an analogy to the AIDS epidemic in the early 1980s. This was before we fully understood the disease, we fully understood the transmission risks, and when there were no medicines that could treat HIV. If you look at the past 40 years of treatment of HIV, only about 50 healthcare workers in the United States have contracted HIV on the job. But if you look at the last few months of the coronavirus epidemic in the United States, over 9,200 healthcare workers have contracted coronavirus. Some of them have died. In one of the earliest weeks of the epidemic here in South Florida, one of my close colleagues who I worked with side by side for 6 years died from coronavirus. Just last week, I had a colleague, we shared patients every once in a while. He also died of coronavirus before he could get any meaningful treatment. The fear that permeates our day-to-day work, knowing that we've lost colleagues already, seeing our colleagues on full life support in the ICU and wondering if we're going to be next, looking around at our teams and wondering who's not going to make it through this, is sometimes overwhelming. We try really hard to focus at work because we don't have the time to process that. But at the end of the shift, when we peel off our PPE and peel off the mask and go home to wash our hands and shower, you can't help but think about who's next. Is it my friend who I just signed out to take over my shift? Is it going to be me? The way that this pandemic is infecting and killing U.S. healthcare workers hasn't really been seen in our lifetime. And it's very scary.